Good evening. We're glad you're with us tonight. I'm Shannon Ogden.
And I'm Ann Trujillo. And tomorrow, the CDC will expand vaccine access to children as young as 12. Supply shouldn't be an issue. There are nearly 300,000 children in that age group in Colorado, and 354,000 doses are due to arrive just this week. Demand could be a problem, though researchers are hopeful that hesitant parents will eventually feel safe letting their kids get vaccinated.
And if they do, the benefit should be near immediate. Denver 7's Russell Haythorne takes this conversation 360.
Children as young as 12 could soon be vaccinated.
News of the FDA's announcement that the Pfizer vaccine is now authorized for children 12 to 15 years old has parents on all sides reacting to that expanded use.
I have two daughters. They're 8 and 5.
I haven't looked into the science about or how the studies have been going yet.
We want to wait till the last minute.
I just want to wait a little bit longer.
The news came with praise from some, hesitancy from others. So we're going 360 with doctors who argue it's safe, a mother who recently lost a child to COVID, another mother of a teen who developed blood clots, parents on all sides of the issue, and we start with the White House vaccine coordinator, Dr. Bashara Shukhair.
We know that the vaccine is safe. The vaccine efficacy is almost at 100%.
Despite that, there is a great deal of reluctance among some parents. A new Kaiser Family Foundation poll shows only 29% of parents would get their child vaccinated right away. 32% said they would wait and see. 15% said they would have their kids vaccinated only if their school required it. And 19% said they definitely wouldn't vaccinate their kids. That research mirrors exactly what we heard from parents.
Like if it's going to benefit them, yeah.
Concerned there's not going to be enough studies done, and I don't want to put my kids through that.
Side effects other than the ones they've shown come up, you never know.
We heard that if we don't do it, the kids can be able to come to school.
In a statement to Denver 7, DPS, the largest district in the state, said, "We do not require the COVID vaccine for staff or students. We do encourage staff and students to get a vaccine."
We just don't know enough. I am in the group that is completely against injecting an experimental drug in my children.
There are certainly cautionary tales. Utah high school basketball player Everest Romney was recently hospitalized days after his first dose of the vaccine.
Just the worst thing is to have the doctor come in and go, okay, well, we found 2 blood clots inside his brain.
Doctors continue testing to find out exactly what caused those clots.
From what I understand, it is not a direct cause of the shot, but rather a perfect storm.
We strongly encourage all of our patients and all of our community to become vaccinated because the risks of the vaccination are much less than the risks of the disease.
On the flip side of that case, an Illinois family is urging parents to get their kids vaccinated after 15-year-old Dakota Morgan died of COVID-related complications.
She asked me why this happened to her and what did she do to deserve this. And I told her that she didn't do anything to deserve this.
Doctors tried to move Dakota to another hospital when she passed away.
I thought it was just goodbye until I drove to the hospital. I didn't think that it was goodbye forever.
Dr. Reginald Washington is the chief medical officer at Rocky Mountain Hospital for Children in Denver. He believes adolescent vaccines are safe.
The messenger RNA vaccines have been around for quite some time. They do not change your genetics. They do not change your puberty status.
He's encouraging parents to talk to your pediatricians.
Get the facts from reliable sources. Obviously, the more children that are vaccinated before they go to school, the safer school is going to be.
Acceptance among parents is now being closely monitored by health officials. Russell Haythorne, Denver 7.